I 100% believe that the very first step in birth control, the very first step in contraception is menstrual cycle education. The very first step. And it's often missed. I believe I'm here to help usher in this new paradigm where the menstrual cycle matters, where menstrual cycle education matters for each woman. I've had countless patients and clients who've come to me for a reproductive issue who also are struggling or they haven't had much luck with the birth control options that we've given to them. And then when they get to me and they're at that point and I ask, do you know what ovulation is? They don't know. Even if I don't say the word ovulation, like say it like that, because ovulation can sound like a big word. Even if it's a big word, I think people should know. I think we should be educating people about what that is. I don't think we should assume that they wouldn't understand. I don't think we should withhold information about someone's body if that information can empower them. And I strongly believe that knowledge of the menstrual cycle, knowledge of your ovulation, your menstruation, when you're luteal, when you're follicular, even without knowing those more scientific words, if you explain to someone what their menstrual cycle is like, and I don't mean when you're bleeding, I mean the cycle with the different phases, without even using the more scientific words, that alone can empower someone so much. I did this today without using the scientific words. I only used ovulation because I asked her, do you know what ovulation is? She said she had heard it before, but she didn't quite know what it was. And I asked her in a different way, do you know at what point in the month you're more likely to get pregnant? And that was giving her a better idea of it, but it still was like a mystery to her. And so this client, this patient who came to me seeking birth control options, and of course I was going to give it to her, I was treating her so she could get the birth control she wanted. But I thought it was important not to let this client go without letting her know, hey, your menstrual cycle is this. It does this. There is a certain point in the month where you might be more likely to get pregnant, and it's because of ovulation. So then I explain what ovulation is, and then I explain the differences she can see in her body during ovulation. During ovulation, we might have changes in our cervical mucus. A larger amount of clear, stretchy, thin discharge is typical during ovulation. Then that's the time you would know that a few days before that, a few days after that, you might be likely to get pregnant. So either abstain or use a condom. No, a woman being armed with that information, I think, is empowering, as opposed to just, okay, I have in this implant or I have in this IUD, I'll just have sex. Of course, with the implant it's different because it's hormonal, and then that inhibits ovulation. So we can't even really track ovulation if you're on hormonal contraceptives. But if I have a client who's on the copper T, it's still not 100% effective. So I think it does more benefit to explain to someone the very first thing, hey, here's how your cycle works. Here's what you might expect. Here's what you can look for. And then that puts them in a more empowered position. And I've been thinking about this today because that same patient, at any given point in the month, you are cycling. At any given point, you are on this continuum of the feminine, the female, the cycle of a woman. You are either menstruating, you might be follicular leading up to ovulation, and after that you're luteal, and then you go right back to menstruation. And without even going into what those words are, I was able to find a way to explain to her that, hey, your energy levels might shift throughout the cycle. You're not going to be the same person every single day. So remember, I was telling you about ovulation. When you're ovulating, you might have more energy. You might feel more tolerant. You might feel more open, more social. But when it's time to be close to your period, you might feel more withdrawn. You might have less energy. You might need to sleep more. And definitely when you're on your period, you might feel the need to sleep more, be more nourished, not do the same things that you would typically do in your household as a mom or as a partner or at work, just explaining that to her, that her energy levels will shift throughout her cycle. Like a light bulb went off in her mind, because she's like, oh, I didn't even realize that there could be a reason for that. I just thought that, I don't know why sometimes I'm just very tired and sometimes I have energy. And honestly, there might be other reasons for that too. But the very first thing that we should know as women is that we are cyclical beings. Understanding, learning about, and embodying the power of the menstrual cycle is how we leverage that cycle. Living in that cycle, learning about that cycle, honoring that cycle and its rhythms is the way forward. And every day in my practice, when I'm met with young women or even women who are perimenopausal, I aim to teach them about this, because I think this is the way forward. As women, we can't ignore our bodies, we can't ignore our cues, and we definitely can't ignore our cycles. I just hope that the little bit of education I can give to each patient at a time will help to give them a new perspective, help to empower them to understand their cycle more, and hopefully, I don't know, hopefully we can change contraception in the future to have some better options for women. Hopefully we can change our entire paradigm of women's health. That's what I'm here for, that's what I'm hoping for, and I would love to take you along with me. My name is Dana. I'm a medical doctor who practices family medicine or general practice in Jamaica. I have a special interest in women's health. I am currently a fellow of integrative medicine with the University of Arizona, and I'm also a certified somatic coach for the female nervous system. I am passionate about creating a space for women and women's health where we can approach cycle irregularities, PMS, PMDD, painful periods, heavy periods, from a perspective that we're not quite hitting with just family medicine and just OBGYN. I want to exist in this space in between the two, where we try more preventive practices, where we try nutrition, we try supplements if needed, we try different lifestyle changes, we try ancient practices, somatic work to understand our body better, to work with our body better, and to truly leverage the power of our menstrual cycle. I think this is the way forward, and I'll be talking way more about this. In the coming months, I'll be opening up limited one-on-one integrative health coaching sessions where we'll be using my favorite modalities such as nutrition, sleep, somatic practices, and other lifestyle changes to help you have a more easeful menstrual cycle. If you'd be interested in that, then please check out the link below in the description to join my email list. And stay tuned for coaching as well as future videos. Mwah.